Warning for all parents: if a newborn baby is not maintaining oxygen, looks blue or greenish, or has difficulty breathing, this can be a medical emergency. Signs to watch for include fast breathing, chest pulling inward, poor feeding, weak crying, or unusual sleepiness. Do not try home treatment or delay medical care. Keep the baby warm, place them on their side, and go to the nearest NICU or pediatric emergency immediately. Low oxygen in newborns can be caused by infection, lung problems, or birth complications, and urgent medical attention can save the baby's life. If you notice any of these symptoms, seek emergency help right away.